Hi guys, it's Girl Blog or Tori, and as many of you know, I did get shoulder surgery on Thursday. It's now Saturday. It's been 2 days since my surgery, and I thought I'd just come on here and kind of talk about what happened, why I needed surgery and everything. If you guys don't really care, then that's fine, but I know some of you were interested about like what actually happened with my shoulder. So basically I was a CNA, very long story cut short. I was a CNA, and if you don't know what that is, it's a certified nurse's aide. I worked at a nursing home. I would lift residents day in, day out for 8 hours every other day basically, plus weekends, and I went and lifted a resident, and she was extremely heavy, and I felt something very bad in my shoulder. I basically just went to a bunch of different doctors, had x-rays. I had x-rays of my neck, x-rays of my shoulder. I had a regular MRI and MRI with contrast. I had basically any test that you could possibly think of, and nothing showed up unnormal. I had a phenomenal MRI exam with contrast. The only thing that came out to be a little weird was toward the my scapula, I believe. They said that there was some leakage, so it wouldn't show up perfectly what was wrong or what was not wrong. Like it could alter the testing, because if you have leakage with the fluid, the fluid is supposed to help you see what the MRI results are, and I had leakage. So this was over a course of many, like 2.5 years. My injury was April 10th, 2015, and here I am today, like the 26th, 27th of 2 years later. So yeah, so I went to a new doctor that I got to choose myself, because with workers' comp, it's a very serious thing. I had to get a lawyer, all that type of jazz, but not to go into too much detail because I still do have an open case right now. But my doctor put me through physical therapy for 6 weeks, 2 to 3 times a week. I did that, and no results. I got a little bit of nerve strength, but muscle and pain didn't do anything. So my doctor decided that I would be a good candidate for exploratory surgery or diagnostic surgery. So come Thursday, I go to the doctor's office, or the surgery center that I'm going to, which is 2 hours and 45 minutes away from where I live in Wichita, Kansas. And I go to the surgery center that I'm supposed to go to, and I get checked in, have to get in a gown, take a pregnancy test. Then they put an IV in me, they put heart monitors on me, a blood pressure cuff. They also put compression things on my legs. I can't remember what it's called. It's like just compression things for your legs, just because with surgery you can get blood clots, and they try to prevent it as much as possible. After all that, I checked in at 10:15 in the morning, about like 11:30 or so. They came in, the anesthesiologist who would be working with me basically was like, hey, we're going to put a nerve block in your shoulder so that whenever you wake up from surgery, it's not going to be painful, because shoulder surgery is extremely painful. And I'm glad I got the nerve block, because it helped a lot. So basically they did like an ultrasound of my neck over here, and he stuck a needle in it. And before that, they did put something in my IV. I'm not really sure what it was, but it basically just made me feel a little loopy and a little more relaxed. I think they put some like anxiety stuff in there too, just to kind of get me relaxed, because I didn't really know a whole lot was going on, but like it was uncomfortable because there was a needle in my neck, and they had to stick a lot of nerve, like the medicine, in my neck. And I remember them wheeling me down the hospital, and we go in this room. It's like terrifying looking. Surgery is like a big deal. It's scary. They had me transfer over from my hospital bed to the surgery bed, which is just a tiny little skinny bed. Had like a thing for my neck, and my arm was like dead. I don't know if you've, like a nerve block, it literally just makes your arm like you can't move it. You can't feel your arm. It feels like it's falling asleep, but like you can't do anything with it, so it's very dead weight. So had my arm there, they were doing stuff, they were hooking me back up to the machines. They started putting an oxygen mask over me, telling me to just take deep breaths and calm down. and remain calm. And I told them like I'm very scared, like it's okay, it'll be over in a minute. The anesthesiologist comes over and is like right here, and she basically tells me, hey, I'm going to basically put the medicine in that makes you fall asleep. So you're going to fall asleep very quickly. You may feel burning or heat in your arm. And so I could feel it going in, because whenever she, like the second she started pushing it in, it felt like my arm was on fire, like in my veins, like a very gross feeling. It was very uncomfortable, and I just gritted my teeth and I was closing my eyes, just like praying that I would fall asleep already. And then I remember the oxygen mask being on, and then that was it. Next thing I know, I wake up in like a different recovery room, and my boyfriend and cousin are there. I'm not feeling very well. They put me on Percocets, I think is the medicine. It's like a generic thing for Percocets, which is basically oxy, codeine, and like a acetaminophen or something. And I've been on oxy before because I had my wisdom teeth removed, and it makes me extremely itchy, which is why I'm like itching a lot. And it makes me very dizzy and nauseous. Like right now, I'm feeling very dizzy and hot and nauseous. It just hits me in spurts. Like earlier, like 45 minutes ago, I was fine, and now I'm starting to feel very sick. So bear with me. Sorry if I'm like looking kind of crazy, but they had been putting that in they put 1 dose of that in my IV, and it wasn't helping, so they put 3 doses of morphine, and that's when I started finally to not feel so bad. And so basically I was in there recovery for like an hour maybe. The lady basically asked me, hey, are you ready to go? And I didn't really even understand what she was saying, but I felt very sick, and I was like, yeah, like I'm ready. Really wasn't ready. So the next thing I know, nurses are in, and I'm standing up, and they're putting my pants on, they're putting my shirt on, and I'm like out the door. Like, put me in a wheelchair, wheel my ass out, I get in the car, and that was it. Like, it was very fast after I got done with surgery. It felt like, kind of felt like I was rushed. So basically that was like the day of surgery. I slept like the full 2-hour, 45-minute drive back home. We did stop to go get food. I tried eating Brahms. I ordered like a small meal. It was like 2 chicken tenders and like a small fry. I took 1 bite of the chicken tenders and wanted to puke. Like, I felt very, very sick. And then yesterday I woke up in a lot of pain, very uncomfortable, very nauseous. We went to Walmart to get like loose shirts. I need shirts that have buttons on them to get it off and on, and I had to go sit down in a wheelchair because I was feeling like I'm feeling now, like very dizzy and kind of like I'm gonna pass out. And then after that I went to physical therapy for the first time, and they changed my bandages, which are, I don't know if you'll be able to, yeah, you can see it. So basically I can't wear a bra because they cut me, like, you know where the crease of your armpit is? They basically cut me like right here, and then I have 3 incisions at the top. I guess I could tell you actually what the surgery, they found out about the surgery and what they did. My doctor didn't tell me this because usually they don't tell you yourself, they tell you like the people that you're with, and then they'll give you the information just because the doctor has to go do other surgeries immediately after. So basically he cut me open, and everything was looking okay until he got to my bicep tendon. He had to pull my tendon up, which if you are queasy about stuff like this, fast forward I guess. My bicep tendon was so far down from the injury that the MRIs and stuff wouldn't have picked it up, so he had to pull it up, and then he saw, and I will try to insert a picture because he gave me a disc of some of the pictures of my MRI, or of my, like, they took pictures when they were in there. And basically your tendon is supposed to be white, and you can sometimes feel see like blood vessels and stuff. That's normal, but mine was very red and irritated and angry and pissed off. And basically he thinks that I pulled my shoulder, like when I pulled the patient up, my bicep tendon strained and then it never healed, because sometimes your tendon just can't heal on its own and needs help. So he did that. He also found bone spurs that he scraped out and some dead tissue that he scraped out. So that's what was actually done with my shoulder. I have to be in this sling for 6 to 8 weeks. I'm not allowed to do this to my arm. I can't lift it up my head. None of that, unless I'm in therapy, and it's passive, I think is what it's called. Basically, I can't do anything myself. Like, I couldn't just lift my arm. But if I'm holding my arm with my good arm, like if I'm holding my hand with my good arm, I can pull my arm up, which I'm supposed to be doing exercises like this, like that, basically. But like, I have to be holding my arm, if that makes sense, like this. Like, does that make sense? Hopefully it does. Sorry, I'm like really, I don't feel good. I feel like I'm missing other stuff. Basically, that's what the surgery was for. So he does think that something was wrong, so that's a really, really good news. He thinks that this will heal well. I'll have full range of motion and everything by the end of the 6 to 8 weeks. So basically, that's like a good thing. Everything turned out to be well. The surgery went well. I am in quite a bit of pain. I woke up today feeling pretty good, and then I tried to change my shirt on my own and put my sling back on, and that's when things started to go downhill. So now I'm feeling like extremely hot and nauseous and not very good. But I'm trying to make this video as short as possible. I'm not going to be able to edit as well as I usually do because I get really dizzy and nauseous feeling when I'm looking at anything, and like the lights right now are even making me sick. But yeah, this is what my arm looks like. It's a pillow sling. I don't have a bra in, so sorry. But yeah, it goes all the way around. That's what I have to wear for 6 weeks. Pretty uncomfortable. I can't even take it off to sleep. I do have a recliner now. My boyfriend's dad actually just brought me one today. Thank God, so it'll be a little easier to sleep and get in and out of at night. I will try to get pictures of the incision sometime, probably not in this video, just because I'm not going to take it off myself, because when they tried changing my dressings in physical therapy, like I was saying earlier, physical therapy sucked really bad. They changed my dressings and I almost passed out and had to lay down with my feet up. So I'm not going to mess with that. I'm going to let them do all that, just because I personally think I couldn't handle it. Like, I can't lift my arm up like this, and you have to kind of get it up because the incision's like down into my armpit, so I have to get the stuff down. In 2 weeks I will go and get my stitches taken out, and I'll be able to get it wet. Until then, I cannot get my incisions wet. I can wash my body like sponge bath basically around it, but I cannot get the actual incision site wet because it can cause infection. I think that's it. So basically it was just like a bicep tendon. What they did is they cut my bicep tendon and then reattached it. So it's kind of what my doctor already was suspecting he was gonna have to do. I feel like I'm missing a lot of information, but if you guys have any questions, just let me know in the comments below and I'll try to get back to you as soon as possible. I am on Twitter frequently, so if you want to talk to me or anything, any updates, Twitter would be the place to go. I'm gonna go though because I'm starting to feel pretty sick, and to the point where I'm seeing kind of like spots, so I'm gonna go lay down. I don't want to push myself. So yeah, recovery is sucking, but it's only day 3, and I heard the first 3 days are the worst, so I'm hoping that the worst is over, and from here on out it's gonna be smooth sailing. I will make an update video and show you my scars after the 2 weeks, and then I have to go back in for 6 weeks checkup. So I will kind of keep you guys updated as time goes on. So I hope you guys enjoyed this video. Let me know what you think. If you have any questions, again, leave it in the comments below, and I will talk to you guys later.